Right, good morning, everyone, and welcome. Hopefully everyone can hear me all right. My name is Derek Coy, and I am the Veterans Health Officer at the New York State Health Foundation. I'd like to first start off by thanking you all for joining us this morning for day 2 of our annual conference on Veterans Health. I also want to be sure to thank our excellent partners that helped put this event together. So a special shout out to New York's Division of Veteran Services and SAMHSA's SMV Center. They're both truly partners, not only in putting this conference together with NYSHealth, but also in the work we all do to ensure veterans have access to the resources they need. Because of the continued need, this year's theme is again focused on preventing veteran suicide, with a particular emphasis on efforts made by the Governor's Challenge to Prevent Veteran Suicide in New York, an incredible collaboration of numerous partners that have focused on ending veteran suicide, and an effort we at NYSHealth have been honored to participate in. For folks that weren't able to join us yesterday, you missed an excellent show, but there will be a recap email sent out with links to a recording of yesterday's panel, in addition to some resources and other information shared during the event. We also have an incredible keynote address provided by Dr. Matt Miller, who many of you may know. He is a phenomenal advocate for veterans and heads up the Department of Veterans Affairs suicide prevention efforts, which is an absolutely Herculean task. The severity and gravity of this topic is really heavy, but he was able to offer what he calls anchors of hope that were very encouraging to hear. So I hope you'll be able to check that out in case you missed it. I thoroughly enjoyed the opportunity to moderate an incredible panel where we focused on best practices for how to talk about suicide, which is often a very tough thing to do. And we heard from our amazing panelists that shared their insight, expertise, and compelling stories to help better understand this complex topic. We closed out day 1 with a panel that provided a deeper dive into the efforts made by the Governor's Challenge in New York that was moderated by one of the best to do it, SAMHSA's very own Dwayne France. So hopefully that will tee up today's program nicely. It really has been an honor to focus my professional work on such an important topic, one that has impacted nearly half of all veterans that have served after 9/11, and one that continues to plague our community. It's also a subject that has impacted me personally on more than one occasion. I'm incredibly grateful that we now have such robust data that we can help explain the severity of this complex issue, but the numbers really can't tell the full story of this problem, nor can they really prepare you for when it happens to someone you know and love. I first experienced this back when I was an undergraduate at the University of Houston in 2009. I was wrapping up my first semester after transitioning out of the service and was doing some last minute studying before taking a final when a buddy gave me a call. We're millennials, so the fact that he didn't text first, kind of raised some red flags. So, I answered it already a bit concerned. As soon as he started off by saying, "Hey man, I'm not sure if you heard about Danny," referring to our friend Daniel O'Brien, my heart sank. There was no way that sentence was going to end well. We were Marines, we deployed like crazy. So you always knew, you could get a call like this, but Danny wasn't deployed. He was married, he had kids. He was your best friend's best friend, just the coolest guy you knew, laid back, super chill, just great guy. So I couldn't compute what happened. I thought he was healthy, maybe it was a car wreck. It just didn't make sense. So when I learned he died by suicide, the only thing I felt for days, maybe weeks, and even, to this day was confusion. I didn't know a single thing about suicide other than it existed. So the news just rocked me to my core. And as the years went on, this became a sad recurrence. Another call, "Hey man, I'm not sure if you heard about Taylor." And the confusion mounted, and I never found a way to deal with what I couldn't compute. These guys were full of life. Taylor's smile light up a room. he admittedly had just the goofiest laugh, and you just love being around him. Just absolutely great guy. Again, full of life. They had families, they were fathers, some of the best people you could imagine. And I just didn't understand. Flash forward about a year in the future, and it really made too much sense for me. When I got out of the service, the confidence and false bravado the Marine Corps instilled in me was unparalleled. I survived 4 years in the military, 2 of which were deployed. So I didn't really think there was anything that could affect me, or certainly nothing would be tougher than what I'd gone through in the service. And I was clearly wrong. I experienced years of complex trauma as a young child growing up, unable to protect my brother from his battle with epilepsy. On countless occasions, a seizure would cause him to fall, hit the ground, oftentimes hurting himself, leading to countless trips to the ER. And the pain of, being helpless and powerless grew inside me for years. I feel like I'd failed as a brother. I couldn't protect someone that I loved. Then in 2004, I again experienced this lack of power when my best friend, Fernando Salinas, was murdered in a case of mistaken identity when we were both 19, a day before his son's first birthday. Being absolutely devastated, I just wanted to run away. 2 wars were raging in the Middle East, and the military was happy to have me and seemed like a great opportunity to get away. So I did. And within less than a year after Fred was killed, I landed in Iraq's Anbar province for my first year-long deployment. The Marine Corps gave me a crash course on how to deal with this trauma by suppressing it with alcohol and a ton of exercise. 2 of my go-to outlets for keeping that pain buried deep. But as many of you know, that can only last so long. My body fought back, and I experienced my first panic attack, what I thought was a heart attack. I didn't know anything about this. And it seemed to never go away unless I was using drugs or alcohol. So I continued self-medicating for years. I moved to New York City for grad school, hoping to again run away from my problems and hopefully start over new, but I found myself completely isolated. I didn't know a single person here, and the loneliness really just compounded my issues. I didn't know what PTS was. I really didn't think mental health care was a real thing, and I just completely lost hope. The GI Bill at the time was transitioning from the Montgomery GI Bill to the post 9/11, so I'm really dating myself there. But they were having payment issues, and I didn't get paid for the first semester I was in New York. So my finances were wrecked. I was worried about getting evicted and had no money coming in, no job. And for the first time ever, I started having suicidal ideations and was contemplating taking my own life. I was just embarrassed by what was happening and didn't feel like I could tell anyone what was going on. So the pain just continued to grow. And this period was without a doubt the darkest of my life. But I didn't want to die. I just didn't want to feel what I was feeling. I didn't want to continue living every day the rest of my life if it meant dealing with the pain of survivor's guilt, of feeling hopeless and feeling like I had no power. It wasn't until my mom reached out, who knew I was struggling, and mentioned me checking out the Veterans Day parade, which I still can't believe I went to. It just doesn't, I don't know what made me want to do it, but things turned around. I was introduced to this incredible organization, Iraq and Afghanistan Veterans of America. And for the first time, I didn't feel alone. I talked to other veterans and realized, oh, wow, there are a lot of folks, unfortunately, that are going through something similar. And we're all kind of in the same fight, having a very similar struggle. Thanks in particular to organizations such as the Headstrong Project, I learned, there was hope. PTSD wasn't a life sentence. It turns out mental health care is real. Shocker. I had no idea. And then I thought back to Danny, and what if he had known this? What if he had access to help? What about Taylor? If, unfortunately, I know it was sadly too late for them, but there were other Dannys out there. There were other Taylors out there, and I wanted to help them. But I had to take care of myself first. And thanks to countless folks out there, a real community, a lot of different resources, VA included, I was able to and continue to get better and wanted to make sure I could for those that didn't have a second chance. In a movie, there'd be like that light bulb moment. I go to the parade, and then a quick montage scene of me going to therapy and like doing some community service, and there'd be like Hall & Oates playing in the background, and then everything would be copacetic after. But the reality is I still struggle, like so many folks out there. But what is different is I have hope, and I have the confidence knowing that there are amazing folks and resources out there that can help when I need them. Also providing hope, folks like Patrice Sullivan, who we heard from yesterday, and Richard Brookshire that you'll hear from today, they continue to give me hope by sharing their stories and empowering me to share mine with the hopes of helping others. And certainly all the folks like you all joining us today that are doing the work to ensure veterans know that they're not alone. You all give me hope. So again, it's an absolute honor to be working on this incredibly pressing topic with amazing people like you all. And it's an honor to tee up what will be an absolutely great program ahead of us today. So to continue building on the great conversation from yesterday, we'll kick off today with a panel moderated by one of the most important voices in our community, Andrea Goldstein, who has been a tremendous advocate for veterans, a source of knowledge for myself and so many others, and great friend of the foundation. We'll be discussing how to identify and address the needs of populations at high risk of suicide, an incredibly important topic with equally some of the most important voices in this space. And we'll follow that up with another discussion that will look beyond the clinical environment and ways legal resources in particular, something folks might not think of as suicide prevention, are able to address the complex upstream factors that can lead to suicide, such as facing an eviction or other issues, financial insecurity, that can compound the factors that certainly impacted myself when I was struggling with these issues. That panel too is packed with folks I am honored to know and work with, and will be moderated by my personal oracle, Benjamin Pomerantz, who continues to be a thought leader and great friend of veterans throughout the state. I bug him all the time for everything, and he somehow puts up with me. So I can't thank him enough for everything that he does. But before I get out of their way and turn the mic over to Andrea, who will be kicking out the first panel, because the nature of this topic, we will be covering some things that many may find troubling or emotionally distressing. So if you or anyone you know is having thoughts of suicide, please call the National Suicide Prevention Hotline at 1-800-273-8255. Veterans can press 1 to be connected with the VA staffer. I've personally used this excellent resource before, and I highly recommend keeping the number handy to share with whomever might be in need. I also want to encourage folks to drop some questions and comments and resources into the chat box. We would love to hear from you, and certainly appreciate you joining us today. We'll also send a recap email with some information and links to the recordings of these panels. So with that being said, I want to get out of the way and turn it over to my friend Andrea to kick the day off, and I'll let her take it from here.